African Centers for Disease Control and Prevention says the BA.2 subvariant of Omicron is now dominant in South Africa and has been detected in a number of other African countries. Omicron was first reported in South Africa in November last year. The dominant form of Omicron, known technically as BA.1, continues to account for the vast majority of confirmed infections globally. But this subvariant, known as BA.2, as I was saying, has begun to outpace it in some places. For more on this, we can speak tonight with the head of the National Institute for Communicable Diseases Center for Respiratory Diseases and Meningitis, Cheryl Cohen. A very good evening to you, ma'am. Welcome to the program. So, how much of a concern is the new subvariant?
So good evening, and thanks for having me. I think for now, in general, the results about the new subvariant or sublineage of Omicron are quite reassuring. As you mentioned in your insert, when Omicron first emerged in South Africa, the dominant variant was the BA.1, and listeners or viewers will know that spread very rapidly. But it soon became clear that it was actually not as severe in terms of the clinical illness as the previous variants of Omicron. So we saw a disconnect between cases and hospitalizations, and although it was still a severe disease and some people did get severely ill, it didn't overwhelm the hospitals as the previous variants had. And it's also true that in South Africa, more recently, this BA.2 variant has come in and replaced almost completely now the BA.1 variant. But for now, it doesn't appear to be more dangerous. In particular, we've recently conducted a study where we looked at the severity of the BA.2 compared to BA.1, and we looked at how likely are people who get the infection to be admitted to hospital, and if they get admitted to hospital, how likely are they to go on to get severe illness. And we found that BA.2 is very similar to BA.1, which I think is quite reassuring.
And Prof, just as you were saying, you've said that the subvariant has a 30% risk of severe disease. Put that in context for those of us who aren't doctors. What does it mean?
Well, so it's not a 30%. It's if you're in hospital, you have a 30% risk of getting severe disease. So by the time you're in hospital, that's already quite severe. So it means that if you're in hospital, and I think COVID in general, right? It can have severe outcomes if you are in hospital. But I think for most people, the risk of actually getting severe disease given infection is much lower than that. In the order of a few percent. So the most people who catch Omicron, in fact, will not go on to develop severe disease. Many will be asymptomatic or have more mild symptoms. It doesn't mean you should, it still means you need to take precautions because a small percent of people could get admitted to hospital. You could also get long COVID, which means you can have symptoms for weeks or even months. So we should take measures to protect ourselves. But that being said, the vast majority of people who do catch BA.2 will not end up in hospital or have severe disease.
And how many variants and even subvariants do we know are going around South Africa at this stage?
So in South Africa right now, Omicron is really the dominant variant. So more than 98% of all COVID in South Africa is Omicron. And of that, most of it is the BA.2. There is still a little BA.1 and maybe the occasional of other variants. But overwhelmingly, almost all the COVID in South Africa right now is Omicron, and most of it is the BA.2.
And you've also warned that it's important as South Africa and the NICD releases this data that it's not extrapolated into other populations. Let's speak about why it's important that when even other countries as well release their COVID data, it cannot be taken as fact that would apply to all nations.
Well, I think what's really critical is to understand that we're in a different phase of the epidemic now compared to the situation we were in 1 or 2 years ago. Initially when COVID came into the world, everybody was susceptible. No one had seen it before. And that's one of the main reasons why it spread so fast and why we saw so much severe disease. Now we know in South Africa, well over 70-80% of people have either had COVID or had a vaccine or had both of them. And so most people have some level of immunity. And that's a big part of the reason why we are seeing this reduction in severity. Some of it is the characteristic of the virus, but actually a lot of it is because people have had their vaccines or they've had previous COVID or both. And I think what's important to note is in South Africa, if we look at immune people, the majority of them, it's actually because they've been previously infected. And this is different from places like Europe and North America, where many people would have acquired their immunity through vaccination. And we know that immunity from natural infection could behave slightly differently to immunity from vaccination. And so that's one of the main reasons why in South Africa, if it appears milder, that doesn't necessarily mean in places where most people have had vaccination, but very few people have had disease, it will behave in the same way.
And you used the word epidemic there, Professor Cohen. I'm not sure if it was deliberate, but how soon do you think it'll be before we move from a pandemic, as per the World Health Organization declaration, to COVID becoming an epidemic?
Well, so in fact, an epidemic is an outbreak. I think the word you're referring to is endemic.
Endemic, pardon me, yes.
Yeah, absolutely, is something that we see all the time. So, for example, flu is an endemic, but we do see increases or epidemics in the winter. So I think it's hard to put an absolute time on it. I think what we are seeing in terms of the changing epidemiology is these effects of population immunity, and it is changing the way COVID behaves in our population. I mean, I can't speculate on when the WHO will declare the end of the pandemic, and we know with COVID you can't predict, right? A new variant could emerge, etc. But I do think that what we in South Africa have observed with Omicron and with our high levels of immunity, it does seem to be modulating the effects on the population. It does seem to be that we are seeing less severe disease, and hopefully, this is signaling a transition to COVID beginning to behave more like our other respiratory viruses like influenza and other viruses. So hopefully, what we're seeing now is part of that transition.